time, I'll turn over to Mr. Cofield, Mr. Smith, in regards to current what is going on, and everything is briefing on this.
The little bit of background, in 1972, through the state of Virginia, there was a request statewide for having juvenile detention areas a pre-trial. The concern was it was nothing local. If you were arrested and you weren't remanded back to the custody of your parents, where do you go between being arrested and where do you go to before trial? And obviously you don't mix children in with adults, so there was a statewide need. The state created regions. Our region actually was a little bigger footprint at that time. It included Albemarle County and Charlottesville, along with Augusta, Waynesboro, Stanton, Harrisonburg, and Rockingham. Our facility for many, many years was off of Montgomery Avenue in Stanton. So until around 2000, when that facility became outdated and needed to be replaced, we originally started looking at is rebuilding on site. The Board of Supervisors at that time was considering a satellite or a new jail facility. Certain people, Mr. Voley and Mr. Wells were co-chairman at the time, and there was a lot of debate on the appropriate for the adult facilities. And then there was a big debate on if you had such a facility, where do you locate it? We had our update of our master plan, and we identified a site for the adult and the juvenile on this campus. And I think all of you know it's located behind us in the old Smith property adjacent to the regional jail. That was built in the early 2000s, vintage era. So we've been operating there very well since that time. Albemarle, we were rated at 58 beds. Albemarle and Charlottesville had an increasing population number. They, in the early 2000s, withdrew and built their own facility. When they left the regional detention center, Rockbridge joined us. Lexington always had been involved, but Rockbridge joined us. So there was some discussions with Vista. There was just some discussion with Allegheny. However, that did not come forward, or they're currently not a member of it. We've been operating successfully back here. Our primary mission, as I indicated to a number of you last week, has always been our own juveniles from our own geographic area. In doing so, as our population, the state of Virginia has done a very good job of identifying children, which ones can be placed with, if it's not your parents, is there a grandparent? Instead of having somebody detained prior to trial, is there a safe, secure place that these youth can be placed before they adjudicated? Because of that, our population at one time was, gosh, 50-some,
60-some.
Yeah, we're overcrowded. That's one reason why Albemarle and Charlottesville left. But after these changes in state law, our population started to drop. We were sitting there with a high mortgage and empty beds. So in working with the superintendent, the first thing we did, we started working with social services and what we call the at-risk children through Comprehensive Services Act. So we've taken referrals from them for a number of years now. That's been a very successful add-on. Not our primary mission, but a very successful program that saved us. Those children, if they go somewhere else, could be up to $90,000 per person to have them removed from our area and have them housed in a facility. So our facility here is closer and allows them to continue their public school education while they're separated from any guardian. Our second thing is we told the state of Virginia, if you have children from other places in the state and you need a place, we will take them for a fee. And we've worked cooperatively with the Commonwealth of Virginia, and they refer children to us from outside our geographic area. We've also periodically worked with other Virginia jurisdictions. If they are overcrowded or if they have some issues, and we do a mutual aid, sometimes we can shift people to them, especially if you have issues with family members or the like. So we have some relationships with other jurisdictions, and that's also a priority. About 5 years ago, the federal government came to us and said, and throughout the state, throughout the nation, asked if there were jurisdictions who had available bed space. And we raised our hand, and we've been operating for 5 years now, a program with ICE. We call it the DUCS program. What's DUC stand for?
Division of Unaccompanied Children's Services.
And I think, because of and it hasn't been our primary, it's been purely a side population for us. They're part of our system. It's not a satellite system. It's worked very well for us, and I think very well for the federal government, to the point this spring, with all the issues at the border, the federal government, and I can understand why they did. They called us and said, there's a church-related facility up in Rockingham County. We're thinking of, can y'all go up there and acquire it and operate it? We'll put a contract. And Joe Paxton, my counterpart in Rockingham, and I talked, and I was chairman, and Joe is a county administrator and a member. They gave it their due deliberation. He talked to his elected officials, and we came back and said, this is not our primary mission. That was going to be stretching our mission, and we came back at our April meeting and decided to decline to participate in that request of the federal government. That same agency said, we're looking at a former college in Lawrenceville, and the question of it is, can your staff be of assistance in helping set that up? And again, we felt that wasn't our primary mission, and we declined to take them up on that assistance level. We said, we're happy to be here. We have, we want to stick close to our primary mission. We have a very good arrangement. What I handed out for you is the cover sheet page. If anybody wants to see the full grant, I can email it to you. It's quite 2 inches thick. But it's, and it's what was in the newspapers, there are up to 30 slots can be made available, male and female. And it's been operating, like I said, for 5 years. We're currently in a 3-year cycle, and this grant goes through September 30th, 2017. So kind of like it. We're not at the absolute beginning, but we're not at the end either. So we're in the middle of an agreement. Whether or not that could be changed or broken, I guess that's for people to look at. As of the other day, there was 20, I think Friday when the newspapers called, I think the population was 24. It's a floating number. Today, it was a little higher, I think.
29 this morning with one leaving, so we'll be back 28, I guess.
29, 28. There was a question of how many actually came from the areas of current issue. And I think the number that was referenced on Friday or Saturday was 7. On Mr. Smith's return, he double checked all those numbers, and it looked as of the day there was 2.
Correct.
Most of the children, as I said in my comments, kind of validated my comments. Most of my history of this program, they've come from the continent of the United States. They haven't really border issue. That's more of a recent. They come from all over the country that are picked up, and the federal government needing what to do with it. So the issue of Texas and the Rio Grande has really been separate from our issues, but that doesn't preclude our population from having to overlap. Whether it's been 7 or 2, obviously it's not 24, and obviously it's not 30, but it could be, and I guess in the worst case scenario. So it's a program. Tim volunteered to be here, so come up to the podium, and board, you can ask. I'm the long-standing chairman. rotational, by the way. But if you have any questions of Mr. Smith or me, we'd be glad to answer.
Would you like to speak to the screening, health issues, educational issues that are involved with these children?
Now, of course, everybody's seen in the media the questions about the medical screening. The children are required to be screened within 24 hours after arrival at any location, or so any of these programs. Almost all the children we get have already been in another program. But that said, all the children within 24 hours are screened and given all the basic immunizations. They're all given tetanus, diphtheria, whooping cough shots. They're all given hepatitis A, hepatitis B, all given polio vaccine, all given measles, mumps, rubella, chickenpox, and all giving a vaccine for meningitis. They're also, if it's flu season, they're given a flu shot too. And they're also screened for TB. If they're under 15, and I'm sure I'm getting this correct, they do the basic skin screen that some of you may have had before. If they're over 15, they're given a X-ray exam. And we've again been doing this again for 5 years, 4 months, and we have not had active TB exposure, so none. So that's what medical is done. We have two full-time nurses in the detention center and a doctor that gives the kids physicals and does other work, and he sees the children 3 days a week. So we have medical staff on board.
Questions?
Mr. Chairman, I'd like to thank you very much for allowing me to come to the facility this morning and meet some of those kids. I have received quite a few phone calls being at this facilities in my district. I was happy to see that all the kids seem to be in good health, and that tends to be the first question that everybody who's called has asked. Are they receiving medical attention? Have they been screened? And I can see that clearly that was being met. The other question was what's being provided then for them in terms of education. You discussed that they're actually in school 12 months out of the year, as opposed to...
Well, the detention center, all the children, local and federal, go to school 12 months a year. We're required by federal mandate to have 5.5 hours of school every day, so 5 days a week, obviously with the exception of Christmas season and typical school holidays we don't have. But the rest of the year they go to school 5.5 hours a day, or they're in education 5.5 hours a day, and they go 12 months a year. And another thing that I'm sure everybody will ask is, all the school education is funded by the federal government. We have four school positions that we fund, and it's fully funded by the federal government. So there's no local cost. No local cost for the medical. It's all federally funded by the federal program. And we have this program offsets approximately, right now in the new budget, $1 million a year of local costs. So it would be local costs that spread back over the 7 members in the jurisdictions. So they pay most of my electric bill, and I can go on and on and on. So they cover all their costs plus more.
And that was the last thing that I was going to say that I've had some calls about where, is there a drain on local dollars generated in order to house these kids? I've been assured that they have not.
This program actually created, when we took it on and started it, created approximately 30 jobs. So we have 30 jobs in the detention center that we would not have without this program. So the 30 jobs here in Augusta County that wouldn't be here if this program come here.
I want to see if I have this right, but you're darned if you do and darned if you don't, because then they say, well, you're gouging the federal government, you're hurting the taxpayer. But we're not charging them an excessive amount in consideration of the fact that we're the owners of the place. We paid for the capital, we put the thing in. We do the same thing to our neighbors Rockingham County, or Rockbridge, or Page, whoever we take them into our jail, we charge them a bit more. But I think I read that they would find our facility to be more economical for most federal placements than if they went other places. Do you have any knowledge of that? Could you speak to that?
Well, I'm sure there are. I assume most of their placements are in higher cost, higher population areas. New York, West Coast, California, et cetera. So obviously the costs are higher in New York than they are in Augusta County. So we're probably still economical for them, and they seem to be happy with us, so.
I think that's the information we needed. I mean, I think from the local board standpoint was the assurance that health-wise, we're not jeopardizing anybody in our community. And from a financial standpoint, our community, local dollars are not being used
Right, that's correct.
for this facility. And I think you've answered those questions. There may be others that come up later that we will need to get back with you on, but Mr. Schultz, you have something for him? What was
No, other than my thoughts is that I pay federal taxes too. And I don't think it's the best usage of federal dollars in what's going on, but that's Washington for you, so they don't operate like we do here locally.
No, I don't think any of us can say that we are happy with the federal immigration program, but in relation to this particular part and the small part that Augusta County is being asked to play to facilitate these children that are being sent our direction, I think we're doing our job, and I think that from my perspective, a key to this versus what I have seen on news on some other reports, these children are controlled. They're not out into the general population. They're being taken care of physically, and they're not being associated with gangs or whatever, and they are being either deported back to their home country or placed with I guess you would say, an eligible family member that is in this country already.
Right. And even those that are placed, most people don't understand this, even those that are placed don't bypass deportation. 98% of them could possibly be deported. So they're not bypassing it by being placed with a family. Also, something that obviously people in Augusta County and Virginia want to know, we've again been doing this for 5.5 years almost. We know of one of our children that's been placed in Virginia. All of them have been either deported or placed in other states. Simply because their family members weren't in this state. So.
Others? Thank you very much.
I asked him to be on standby for Wednesday night. Do you think you need him?
Yes, I would like to have
See you
you.
Wednesday, 7 o'clock.
Good. That's it. All right, thank you. Y'all have a nice afternoon.